Hello and welcome. I'm Amy from Wellness and Myofascial Release, and in our video today we're going to cover the principles that you need to understand when doing my particular method of myofascial self-care stretching. So who am I and what goes into this particular technique? So I'm an occupational therapist and have nearly 3 decades of experience, and as an occupational therapist I specialize in looking at how people use their body in their daily life and how that in turn shapes your body and how that shape then contributes to your experience of tension and pain in your body. And during my career I've looked a lot at and practiced a lot of ergonomics, look a lot at body alignment and posture. I've also been practicing the Barnes method of myofascial release for nearly 30 years and applying that to client care. I'm also a certified yoga instructor, and I'm trained, certified also in a natural movement method called MoveNat. So I look a lot at the evidence as well and apply that to my clinical experience, and all that together has helped me to create this particular method that I've been using with my clients for quite some time. I use it myself as well and find that it's very effective. I do teach workshops in this as well, so if you are interested in the videos, you might want to check out the workshops too at merewellness.com. So, as always, whenever you're starting something new, especially if you have any issues at all in your body, make sure you consult with your medical professional that knows you best on whether or not you should be starting something new at this time and whether or not it's safe for you. Other safety considerations: if you have any kind of diagnosis where your bones are more fragile, then you need to be particularly careful, and you may not want to do any of the stretches that require some of the props, which I'll go over here shortly. There's plenty of stretching options where you don't need to use any. If you do choose to use some props, you'll want to use the bigger, squishier balls and stay away from any bony areas in your body. If you really want to try this method, I would suggest that you have a one-to-one consult with me and we figure out what would be the safest for you. If you have any kind of medical condition that causes you to bruise easily, or you take any kind of a blood thinner medication, then really go even more gentle than I'm already asking you to go, and make sure you use the squishier balls if you're choosing to use props with some of your stretches. If you have any kind of a recent injury or surgery, and your medical professional has given you precautions, contraindications, limitations, things not to do, then you must respect those in the process of stretching as well, and should really wait until you're clear of any limitations before you begin this particular program. If you're not sure, if you've got some permanent limitations and you're not sure if it's right for you, you're welcome to contact me. So what do you need to get started? A lot of the stretches that I teach don't require any props at all and are very effective. Having props, though, gives you literally unlimited options for getting into the superficial and deep tension and pain in your body. And in a lot of the videos you'll see a lot of these different props being used, and I'll explain here and in there how you can do that. Having a chair nearby, especially if you're doing some of the standing stretches, can really help with balance and leaning into the chair as well. Even if you think you have good balance, having a chair nearby can be helpful when you're trying something new. Lots of different balls and rollers. Any ball that you use should have some squishiness to it. Don't use anything super hard on your body to put pressure on your body, except under very limited circumstances, and I'm not going to cover those in this particular video. But having something with some squishiness to it, even the smaller ones have some squishiness to them. Okay, when you're using the balls, you can lean into the wall or you can use the ground. The wall is a good idea if you're just wanting to get a quick stretch or release in, or you're at work and you can't get on the floor and you want to do a quick shoulder release to get some blood flow in there. But working on the floor gives you so many more options, and getting down on the floor and moving on the floor is really good for your body as well. You don't need to have any kind of a mat. The harder the surface, the more intensity you're going to experience, pressure from the balls. The thicker the mat or the carpeting that you're working on, the more the floor is going to absorb some of the pressure in the ball, so just be aware of that when you're getting started. Items that can be helpful to you, starting with a bigger, squishier 4-inch ball, especially if you have a lot of tenderness in your body, is where you want to start. Often recommend that you have 2, and you'll see in some of the videos why. The smaller, squishier ball has some friction to it as well, which is really helpful when doing some of the releases. Having them in a set with a bag can give you so many options. I don't go anywhere without these. And then having a smaller ball can get into some of the smaller areas of the body. Again, some squish to it, but this is just a little bouncy ball, super ball. Having a strap, a yoga strap, something like a scarf or a belt will also do. When you're laying down and getting into the hips and the back, positioning the legs differently can give you so many wonderful options to get deep in there. Having a small towel available, especially when you're moving from this ball to this ball, and then maybe this is maybe a little too much. Covering that to provide a little more surface area can really help you modulate that pressure into your body. And then having some blocks available can help you tilt and position your body differently to provide that support so that you can relax your body. The roller can be a better option for some people if coordination on the balls is just not, it's difficult to achieve. This can be a better option, but I don't go to this too often. And then having a half roll is a wonderful tool for stretching the calves, the feet, the toes. And then always have water on hand when you are stretching your fascia. Okay, so you should always feel a mild to moderate stretch or mild to moderate sensation in your body when you're stretching it or putting pressure into it. You don't want a lot of intensity. You don't want pain. That's totally counterintuitive to this particular method. Your fascia is designed to protect you, and you have to create a condition of stretching in which your body feels safe and feels comfortable to release. Pain, if you're feeling pain that causes you to hold your breath or tense your body, that's too much. You can experience some pain that hurts good kind of sensation, but it should always feel therapeutic. Always breathe deeply and slowly using your respiratory diaphragm when you breathe. That movement of the diaphragm stimulates the vagus nerve and stimulates that relaxation response in your body. If you're not sure what diaphragmatic breathing is, there's another video on that. Moving so that you can positioning yourself so you can find that most relaxed position of your body. And so using the props, if you need to roll onto your hip a little bit more, then propping yourself up with something so that you can find that relaxed position. Once you're in that position, soften as much of your body as you can into that stretch, and continually doing a scan of your body from head to toe to double check, are there any points of tension in your body that you need to let go of? And you may notice that you'll find patterns of tension always in your jaw, always in your hands, letting those go, and that can help you when you're off the mat as well. Be gentle, don't force anything, just meet your body's resistance. So if you're stretching in or you're pushing in, not forcing your body into that stretch, but just meeting that tension and then waiting for your body to give, waiting for your body to yield. Always move slowly in and move slowly out of a stretch. Everything is slow. Be patient. You're going to need to hold some of these stretches for 2, 3, 4, even longer, depending on how tight your body is or how thick of an area you're working on. But being patient with the release, it's not going to happen super quickly. You need to wait until you feel that yield or the dissipation of the tension or the pain in your body. Keep your body in best alignment. If you're stretching your hips, don't let your upper body fall and collapse. Keep that good alignment. Also symmetry. If you always have pain or tension in the right side of your hip, then make sure you work or spend some time on the left side as well to keep that balance in your body. When you are using the balls and the rollers, resist the urge to roll on them. That can provide a nice self-massage, but it's not going to provide a release in your body. The pressing and the holding will provide that release, and I will talk you through that in all the different videos. Now, after you do the release or feel the release, some gentle rolling on the ball can provide some mobilization of the fluids and some relaxation of the muscles. But never ever aggressively roll your body on any of these tools. Between the different releases, moving your body, you're taking your body through a range of motion, can help to mobilize the tissues, to pull in blood flow, and to pump out the waste. After you stretch, make sure you move very mindfully, move very slowly. When you're changing and releasing your fascia, you're changing the shape of your body. And so you may feel awkward or even a little uncoordinated. So moving slowly into your regular routine or exercise, working very mindfully is important. And drinking plenty of water after your stretching session too. If you stretch and you feel more achy or headachy, then make sure you drink a little bit more water. Some common questions that I get are, how often should I stretch? And I think everybody should stretch very regularly, but it often depends on how you use your body. Our bodies are really meant to move they're meant to move all day long through lots of different ranges of motion, and we often don't get a lot of variety in our movement in our culture today. So the less you move and the less variety of movement, the more you need to add that into your life and add stretching if you can't add the movement. So I recommend that you do a little bit every single day. If you have a job or a lifestyle where you are more sedentary, then sprinkling those stretches throughout the day. 1 here, 2 here, 1 there. And it might be as simple as when you get up from your computer to go to the bathroom that you do a shoulder stretch. And then always try to throw in a longer session a few times per week. And by a longer session, that might be 15 minutes, it might be 30 minutes. I recommend that you start with something that you've tried and that you really like and you get good outcomes. Maybe if you always have a little bit of shoulder pain, then start by working on your shoulder and then move to the opposite shoulder, and then just move from there and follow the intuition of your body and what feels good and what feels right for you. If you have any more questions about this, you are welcome to contact me at marewellness@gmail.com, or if you go to marewellness.com, my website, there's a lot of resources on there as well. And as you go through and you try the different videos, the different stretches, I'll remind you a lot about the props and a lot about the principles, but you may occasionally want to come back so that you make sure you're following the principles, especially the safety principles all throughout your stretching. Thank you. I appreciate you being here.